Acute leukemia is a kind of hematological malignancy with high mortality and poor prognosis. It requires a complex and highly diversified treatment because of its wide prognostic heterogeneity. Traditional treatments include supportive care, chemotherapy, hematopoietic stem cell transplantation, immunotherapy, and targeted therapy essential. Optimal management of patients with leukemia requires careful attention to supportive care, including infection prophylaxis and blood transfusion when needed. Other supportive care measures such as hemorrhage and hyperleukocytosis treatment, prophylaxis of hyperuricemia, nutrition are essential. The first goal of therapy is inducing a complete remission, the CR. CR is defined as elimination of the leukemic cell population in marrow and restitution of hematopoiesis, resulting in a normal or virtually normal white cell, hemoglobin, and platelet concentration in the blood. Usually, chemotherapy can be divided into remission induction, consolidation, and intensified therapy, and maintenance therapy. For AML, DA, that's daunorubicin plus LRC, or IA, that's idarubicin plus LRC, are the most common regimens in induction. And later, when the patient gets CR, high-dose LRC is used for consolidation therapy. Retinol acid is the first choice in treating APL patients. Arsenate can also be used. Decisions to proceed to allogeneic transplantation should be individualized. For patients with high risk factors in allogeneic sibling transplantation in first remission is often recommended. No maintenance therapy is suggested for AML patients except APL. The induction regimen for ALL patients is the VP-based regimen, including VLP, VDP, VDLP, then have a consolidation of CR. Patients with a Ph-positive ALL and those with a poor initial response to induction therapy has been recommended to undergo allogeneic stem cell transplantation during the first remission. Unlike AML, for all ALL patients, we suggest a maintenance therapy for 2 to 3 years. CNS is easily involved in ALL, so prevention and treatment of CNSL is needed. CNS is a common secretory for leukemia cells. To prevent and treat CNSL, intrathecal therapy with MTX, LRC, and dexamethasone is effective. In case of testicular leukemia, radiotherapy should be considered. In recent years, the emergence of immunotherapy has brought hope to hematological malignancies. Here, we reviewed the research progress of immunotherapy in acute leukemia. Immunotherapy mainly includes targeting AML, AL cell surface antigen, such as CD33, CD123, CL1 on AML, and also CD20, CD19, CD52 on ALL, relieving T NK cells immunosuppression such as PD1, PD-L1, CTLA4, or using immunopotentiator such as OX40 agonist, and adoptive cell therapy such as CAR-T essential. The use of immunotherapy in the treatment of acute leukemia has greatly improved the choice of treatment. It not only provides an opportunity for hematopoietic stem cell transplantation, but also increases the MRD response rate, reduces the MRD level, and further improves the remission time and survival time. Combined use of multiple immunotherapies such as checkpoint inhibitors combined with other immunotherapy can improve efficacy and duration of response. Although immunotherapy exhibits a good prospect, its toxicity deserves attention. The side effects of immunotherapy on normal HSCs are urgent problems to be solved, and more precise targets need to be studied to reduce the damage to normal cells. Since the year 2017, there has been an explosion of newly approved treatment options in AML, with the majority of new drugs targeting specific gene mutations and/or pivotal cell surface pathways. These drugs include FLAG3 inhibitors, IDH1 and IDH2 inhibitors, BCL2 inhibitor, venetoclax, hedgehog signaling pathway inhibitor. CPX-351 is a dual drug liposomal encapsulation of daunorubicin and cytarabine and has a fixed 1:5 ratio of these drugs. It is for newly diagnosed ML, MRC, and TAML. Mylotarg is a humanized anti-CD33 monoclonal antibody linked to the cytotoxic agent. It is used in CD33 positive AML. I think that with the development of cytogenetics and molecular biology, more and more new drugs will be used for the treatment of leukemia. Thank you very much for your attention. Thank you.